Shoulder pulleys flexion. Start by attaching the pulleys to a door. Just place the cord over the top of the door and close it. This should lock the pulleys to the door, but if they're loose, just use a different door. Now sit comfortably on a chair in front of your pulleys. You want them straight over your head. Hold a handle in each hand and pull up to the front by using your good arm to stretch your bad one. Do this for 5 minutes, once a day. This exercise shouldn't be painful. Shoulder pulleys abduction. Start by attaching the pulleys to a door. Just place the cord over the top of the door and close it. This should lock the pulleys to the door, but if they're loose, just use a different door. Sit comfortably on a chair with the pulleys above your head and hold a handle in each hand. You want to pull out to the side by using your good arm to stretch your bad one. Do this for 5 minutes each day. This exercise should not be painful. Don't worry if pulling out to the side feels more restricted than pulling out to the front. This is to be expected. Wall creep flexion. For this exercise, you should stand facing a flat surface, such as a wall or a door. Now creep your fingers up the wall as far as you can go with your affected arm. When you've gone as high as you can, creep your fingers back down. Repeat this 15 times. You can do this exercise 5 times each day. Wall creep abduction. Stand side on by a flat surface as you begin the exercise. Your affected arm should be nearest to the wall. Now creep the fingers of your affected arm up the wall as high as you can. Once you've gone as far as you can, creep them back down again. Repeat this 15 times. You can do the exercise 5 times per day. Towel rotation exercise. Be aware that this is an advanced exercise. You can do this in 2 ways. Your bad hand can be the top hand or the bottom hand when performing the exercise. It's usually hardest to have your bad hand at the top of the towel. Begin by throwing a towel down your back. Now use your good hand to pull the towel up or down. This will stretch your shoulder into rotation. Repeat this 15 times and do it 5 times per day. Static shoulder rotation, rotator cuff, internal rotation. Begin by placing your hand or wrist onto a door frame. Make sure that your arms at the side of your body and keep your elbow at a 90-degree angle. Now rotate your arm inwards from the shoulder against the door frame. Use enough pressure to get to the edge of pain, but don't push into the pain. Hold the position for 5 seconds and then relax. Repeat this 5 times. You can do this exercise 5 times per day, but it isn't recommended within the first hour after waking up. Static shoulder rotation, rotator cuff, external rotation. Begin this exercise by placing your hand or wrist onto a door frame. Make sure that your arm is at the side of your body and that your elbow is at a right angle. Now rotate your arm outwards from the shoulder against the door frame. Apply enough pressure to get to the edge of pain, but stop before you feel any. Hold the position for a count of 5 seconds and relax. Repeat this 5 times. You can do the exercise 5 times per day, but it isn't recommended within the first hour after waking. Resistance band internal rotation. Using a resistance band makes the shoulder strengthening exercises more advanced. Begin by tying the band to something solid. A lot of people use a door handle for this. Make sure your arm is at the side of your body and keep your elbow at a 90-degree angle. Now rotate your arm inwards from the shoulder, stretching the band as you do this. To warm up, do each exercise for 15 repetitions. Do this twice using a low resistance band. Next, perform 8 to 14 repetitions and repeat this for 4 sets with a 30-second rest. Vary the resistance using different bands until it's difficult at about 12 repetitions. If you can do 15 repetitions, the band is too light, and if you can't get to 8 repetitions, it's too heavy. These exercises shouldn't be painful. If they are, then you're not ready for them. Resistance band, external rotation. This shoulder strengthening exercise is more advanced as it uses a resistance band. Attach the band to something solid and make sure your arm is at the side of your body. Keep your elbow at a 90-degree angle. Now rotate your arm outwards from your shoulder, stretching the band as you do so. You should warm up by doing each exercise for 15 repetitions. Do this twice using a low resistance band. Next, perform 8 to 14 repetitions and repeat this for 4 sets, with 30-second rests. Use different bands to vary the resistance. You want it to be difficult at about 12 repetitions. If you can do 15, then it's too light, and if you struggle to do 8, then it's too heavy. If these exercises are painful, then you're not ready for them. Shoulder scapular positioning. Begin the exercise with your shoulders relaxed. Now shrug your shoulders towards your ears as high as you can, without feeling pain. Next, pull your shoulder blades back towards the middle. From this flexed position, you should now pull your shoulders back down to a resting height. Keep them back as you pull them down. Hold this position for 5 seconds, and repeat this 10 times. Try to do this exercise 5 times per day. Shoulder stability. First, lie down on your side with your bad arm the furthest away from the floor. Raise your arm straight until it makes a right angle and is perpendicular to your body. You now need to set your shoulder blade. To do this, shrug your affected shoulder towards your ear, as high as you can without pain. Next, pull your shoulder blade back towards the middle. From this contracted position, pull it down as far as you can comfortably. Make sure you keep your shoulder blade towards the middle as you do this. Keep your shoulder in this position throughout the exercise. Now that you've set your shoulder blade, you're ready to begin the exercise. First, exercise your shoulder by moving your arm up and down in a slow oscillating motion. You should do this for 2.5 minutes. Doing it for longer is harder. Next, move your arm backwards and forwards in the same way, again for 2.5 minutes. If your shoulder blade starts to move, then you've moved your arm too far. If this happens, don't worry. Just set your shoulder again and try again with a smaller motion. As your scapular stability improves, you'll be able to make larger movements with your arm. Do the exercise for up to 5 minutes, once per day. It's best to do this at the end of rehabilitation to prevent recurrence. Shoulder pendulum exercises. Begin by leaning forward onto a solid surface, like the back of a chair. Next, let your arm hang and gently sway it like a pendulum, forwards and backwards. Do this for 2 to 5 minutes. Now repeat the same thing again, but go side to side this time. Try to do this 5 times per day. Spread out as evenly as possible. If it hurts, you're doing it for too long, going too hard, or both. Resistance band flexion. Begin this exercise by standing on one edge of a resistance band and holding the other. Now keep your elbow straight and lift your arm up to the front. You'll feel the resistance as the band stretches. To warm up, do each exercise for 15 repetitions. Do this twice using a low resistance band. Next, perform 8 to 14 repetitions for 4 sets, with a 30-second rest. Vary the resistance using different bands, until it is difficult at about 12 repetitions. If you can do 15, then the band is too light, and if you can't do 8, then it's too heavy. This shouldn't be painful. If it is, then you're not ready for the exercise. Resistance band abduction. Stand on one edge of a resistance band while you hold the other. Keep your elbow straight throughout the exercise. Lift your arm out to the side. You will feel the resistance as the band stretches. Repeat the exercise 15 times to warm up. Do this twice using a low resistance band. Next, Do 8 to 14 repetitions and repeat for 4 sets with a 30-second rest. Vary the resistance using different bands. You want it to be difficult at about 12 repetitions. If you can do 15, then the band is too light, and if you can't do 8, then it's too heavy. You shouldn't feel any pain. If you do, then you're not ready for the exercise. Sleeping positioning on your back. Place a small pillow under your bad arm. It's up to you whether you have your arm up or down when sleeping on your back. Here, the arm is up on the right side and down on the left. Many people find that they need 2 pillows, one under their shoulder blade and one under their arm. It's important to make sure that you don't have your arm higher than at a right angle to your body. If possible, keep it below 75 degrees. Sleeping positioning on your side. When sleeping on your side, if the bottom arm is the one that's affected, a pillow can help to take the weight from it. Most people find that this is the worst position for sleeping. If you're sleeping this way, try not to tuck your hand under your pillow or your head. This is usually a bad posture. Keep your arm lower than 90 degrees to your body if you can. The lower the better, usually. You should also make sure that you don't put your arm flat under your body. This will squash the shoulder. If the bad arm is the higher arm, use a pillow to rest it on. If you just let your affected arm hang onto the bed, this can cause pain, so don't do it. You may need to roll up a pillow to prevent this.